Hi everyone, Michelle here from the Appearance Clinic, and today we're going to be talking about dermal needling. And as you can see, I'm actually not naked. I do have clothes on, but I'm going to actually be doing some needling on myself today. So this practice has been around since the mid-90s, and basically what it's doing is causing a wound, and what we want is the wound response. So what we do is we cause hundreds, if not thousands, of these little micro injuries, and then we get a wound response. So we get a proliferation of cells to heal those areas over. So there are various types of instruments that can be used. You've got derma stamps, which have a flat base with 30 odd needles on, or we have dermal rollers, which is what I'm going to be using today, or what we have is a derma pen, which is what I use in the clinic. And with the derma pen, I can adjust the depth from like 0.01 up to 2.75. So I can go quite deep. And you're not going to be going deep unless you're actually working on scar tissue. So immediately after treatment is when you get this injury which causes a platelet response. And that's to clot and to heal over all those small injuries. So from that you'll get a little bit red. So you have a generalized erythema, and your skin will feel quite tight, because obviously what's happening is that you get a little bit of swelling. So things start to be reduced in their appearance immediately because you've got that swelling. Now that swelling settles down within 24 or 12 to 24 hours. But the treatment continues working up to 42 days afterwards, because what it's doing, it's aiding in the formation of the blood vessels and the oxygen supplies, and boosting growth factors. So it really is a good modality to mix up and to introduce your skin to other treatments. Now, I've prepped my skin today. So what I've done is I've used Purity Clean by Cosmetics. So that's got some lactic acid in it. It's pepperminty smell. It's quite nice and fresh. And then what I've done is I've used a prep toner. We don't sell many of these. So these are what we use in the clinics before we do tests for this one. So it's a prep, but you could use isopropyl alcohol, you could use hospital grade acetone, because basically what that prep toner is doing is degreasing the skin. My skin is squeaky clean. And then what I've done is I've introduced some 30% BHA salicylic acid. Now I've done a couple of layers of my skin and my décolleté. So I'm all ready to go. Now, obviously, when you're in the clinic and you have this treatment, we're gloved up because obviously we're protecting. So with the rollers, this one I'm using is 1 mil. So it's not a particularly deep one, but it still will get an erythemic response. And basically with the rollers, identify your area, keep your skin taut, and then so you can, when you're doing a décolleté, for instance, you roll up. And you can roll back down again over the same area. First time you do it, I recommend you just do one at a time, and then so you just go up and down, up and down. Now when you're doing needling, and I'm pressing quite firmly, it's not the most pleasant sensation, I have to be honest. However, it's the results that I'm after, and there's no beauty without pain, and over the sternum is particularly nasty. So this would constitute one pass, okay? So what we do then is, because we want to make sure that we do it in a different angle. So I'm going to come down, follow the line of my clavicle to my center of my sternum and back again. Ooh. And as you can see, my décolleté is starting to get a little bit pink. And that's perfectly fine. Ooh, it's very hard to do on the other side of your chest, actually. Ooh. So that's 2 passes. Now I'm going to leave that a second, and I'm going to do my face. So I'm going to start on the side, and what I always say is just try and keep the skin taut. So you can come in, you can come round. Now, obviously, sit on the bone. Do not go over soft tissue. So when you've done one direction, then you go, okay, well, actually, I'm just going to do this bit first. So I've done that area. Now I'm going to do a different direction. Hey, and then what I'm going to do is just come up at an angle. So quite straightforward. So a little bit pink, and I can feel when you're using the roller, you can actually feel the little pricks where it's breaking the skin. But afterwards now you just feel warmth basically. So I want to do one more on my décolleté, and I'm going to come across at an angle that way. And as you can see, I'm doing a little bit more. So it's all about that wound response. Eek. Oh my word. I'm surprised I haven't sworn. It's very hard sometimes when you have to do these things to yourself, but I don't let anybody else do anything to me. Don't trust anyone else. Now, okay, so, and then the most painful bits are around the lips and the nose. So when you first get hold of a roller, and we are selling some of these with little bottles of acid so that you can do this at home while we're in this lockdown phase, don't press too hard. Go once until you get comfortable with that sensation. So you can see that my décolleté is a little bit pink, and my face. So this feels a little bit stingy around here, but that's all fine. I'm going to do a bit more work over here on my nasolabial fold. And then I'm going to come across on my upper lip. And then forehead. Now I am not pressing as firmly on my forehead, and I tell you why. I have no fat on my forehead, so you are very, very sensitive. Ooh. So the benefit, collagen remodeling basically. So it's a different modality to actually go Control-Alt-Delete to the skin and to reboot to invoke that collagen response. So over the next 24 hours, all those little holes will be closing up, and then over the next 42 days, I'm going to have a boost in plasma with collagen and elastin, and it just improves the overall condition of the skin. Now I'm going to follow this up with the Avante DNA Repair Serum and a moisturizer and a sunblock. So if you're going to be doing this at home, remember, do not have retinols a couple of days ahead. So it's good to use them and then stop them a couple of days ahead, and then go on, do your needling, and then give yourself 24 hours and you're back on board with your retinols and all your antioxidants. So you can use your antioxidants today, like a vitamin C if you wanted to, but me, I prefer to just get the needling done, to use things to calm the skin down, use the DNA repair, moisturizer, and protect from the sun. So I hope this has been good. These kits are going to be online for $84, and these rollers have a detachable head, so they come with a 1 ml, and then you can buy it at various depths if you want, and we'll provide you with a little bottle of acid. All right, see you again.